How much discomfort or pain down there is considered normal and when is it not?
Can I have my doula at my
If
birth?
you don't have a period,
As the
how do
body
you
is
know if you're going
changing,
into menopause?
what's
How much
normal,
change in
what's
my
not
cycle over
normal,
At
time
what
menstrual
age
is
should we
cycles
start
is
asking
I don't
questions
know.
light
about
sometimes.
You're seeing a
perimenopause?
lot
So
of
now it's
things
really
on social
heavy.
media.
Who do I talk to?
So many people relate and maybe people just don't talk about it.
I felt like something was wrong. She said, "What's it feel like?" I said, "It feels like class." I mean, I could start crying right now because it was that bad.
Like there's literally so much that has to happen to even get pregnant. It's like you want something so bad and then for it to just keep not happening. We didn't want to think anything was wrong, but I feel like we knew.
Once I turned 45, it was like a switch that came on and everything just started changing all of a sudden.
It's so fun being a woman.
There has been secrecy, kind of a dark cloud around women's health.
Thank you all so much for being here today. We are excited about this discussion to answer some questions that you all may have.
There's still a hesitancy on the part of a lot of women to be able to talk about their own body and what they're experiencing. And it's okay, but it's also equally important to know, why is this happening? And is there anything that I or my provider we can do together?
We are thinking of starting a family soon. What should I be doing now? For couples who are planning on starting a family, I think the number one thing is to kind of make sure that you're taking care of your own health. Things like starting your prenatal vitamins. I think we do a really bad job of telling everybody that they work best before you get pregnant.
I also tell patients that their partners, because their partners are half of the equation, make sure they're taking men's daily vitamins and make sure the man has a healthy lifestyle as well.
Knock, knock, hello.
I had a teacher in med school who was little and old, and he'd always go like, "The pregnant woman is a fascinating phenomenon." And I was like, "You're such a weird dude." And then I just the more I think about it, the pregnant woman is a fascinating phenomenon. There's all of these changes that are happening physically, and then there's all of these changes that are also happening hormonally and mentally too. Even if you are as healthy as possible, that doesn't necessarily mean that things are gonna be normal and what you think is gonna happen.
The night before the anatomy scan, that's kind of when everything happened. He was kind of starting to come out at home. We were kind of having troubles getting pregnant, maybe 6 months or so, and we weren't having any success.
Initially, she'd been on birth control for so long that you want to give people some time to sort that out. Our bodies do adjust, but hers never did.
You want something so bad and then for it to just keep not happening is really hard.
And so kind of trying to figure out how can I help to give you a passable chance of having the ability to time intercourse and get pregnant.
I feel like she knew my cycle as well as I did. She introduced us to the ovulation strips. We would do blood work each cycle to figure out if I did or didn't ovulate. When I had let them know I was pregnant, everyone was like, "This is crazy," just because it's real. It's awesome. I think it was 8 or 9 weeks. You can see them moving and they look like a little jelly bean. Yeah, that was just the best. There's literally so much that has to happen to even get pregnant. It's actually crazy that we can do it. It honestly boggles my mind.
It's hard because when you think about obstetrics, you think about babies and deliveries and birthdays and happy. And that is the case for a lot of my patients, but it's not the case for all of my patients, and it's certainly not the case every time.
I just had some weird bleeding, which again is hard because that's really normal in pregnancy. So Dr. Miro and Dr. Verdaka were like, "We would definitely want to see you more often until the bleeding stops," basically. And it would. So that was also the hard part. It was always worrisome, but then also his heartbeat was always fine. The night before the anatomy scan, that's kind of when everything happened. He was kind of starting to come out at home. I mean, we just left. We didn't think about anything and just drove. So that was also really scary. So I think at that point, we didn't want to think anything was wrong, but I feel we knew.
You're allowed to sit and be sad and feel feelings. It doesn't matter how much time has passed. That's not something that you just kind of walk past.
That was just really hard because, right, we took so long to even get to this process.
One of the things that I feel really strongly about is supporting patients after that during, right?
They just made us feel so comfortable. I mean, obviously the most like terrible time and like vulnerable time, but they were like explaining everything, and they did a lot of testing after, so they were able to test my placenta and kind of figure out like maybe reasons why. We had a miscarriage again in September, actually. That was hard. But then we got pregnant with Will 2 months later.
For Lauren, I know that she wanted to be seen more often. She wanted to get a few more labs to kind of keep track of things a little bit more closely. And that provided her like a safety net and some reassurance.
There's been an emphasis on the mutuality and the cooperation now that exists. It used to be you go to a provider and the provider tells you what to do. Now it's much more of a conversation.
Dr. Miro wanted to check in on me like mentally and stuff, so that was really just great. Like, you know, the first time I saw her, just like a big hug and like, you know, just knowing she's supportive.
We all got into it because we like this job and we like our patients. And I think for me, that makes my job the best, is that I know you and I know what happened last time and I know what your baby's name, and I know that this is important and this is cool and this is a big time, and I'm going to do my best to get to know you like for the whatever time that I have you, because that makes your experience better, right? But it also makes what I do worth it.
So I was already going to be induced early, I think around like 39 weeks, so nothing crazy. But my water actually ended up breaking on its own at like 37 weeks. So that was crazy, and everyone was so great. And I think just going in, everyone like knew our past. We were very sensitive about everything, and they said I was really strong. I was like, wow, okay, let's do it.
We have a very good team, and I think that's one of the things about healthcare and obstetrics specifically. It's kind of like a team sport. What our nurses do has a ton to do with how our outcomes are. Having those teammates who are helping me to care for this patient and achieve the best possible outcome, I think that's integral in how patients have a good experience and how their delivery goes. I'm so lucky to work with the people that I work with.
I just feel like meaningful having Dr. Miro there too, just because she had been working with us honestly for at that point like 2 years and just had been through everything the first time. So it was just really, I feel like full circle. So crazy.
Yeah. Smiling? Crawling?
Yeah. No.
Mobile?
No.
Not yet. He's too heavy.
He's so big.
He's so fat.
That's what I was telling them. He like can't roll. He's at a really fun age. I feel like he's like smiling, laughing, eating.
He's like, Mom, why?
I'll see you in like a month.
Yeah.
That's when I moved in.
We're the leader when it comes to women's health care. All one has to do is recognize all the births, Good Samaritan, Bethesda Butler, McCullough Hyde, and now TriHealth Clinton. We are about life, wholeness, creating that caring, compassionate atmosphere. It was really 4 Sisters of Charity who were invited by Archbishop Purcell to take over St. John's Hospital for invalids, which eventually evolved to become Good Samaritan Hospital. And then it was also the German Methodist deacons who went to the Mount Auburn area carrying picnic baskets that had medical supplies in visiting homes and meeting the needs in a home-based way, which eventually evolved into a hospital, Bethesda. And they were about healing, restoration, and wholeness. And how do we create a healthy community as well as address illness and sickness? There's a whole sense of serving. I'm being cared, I'm being respected, I'm being valued. In my opinion, and my questions are being valued.
When should I send my daughter to the gynecologist for the first time? So we get this question a lot. For our first timers, it's very, very important that you come to the gynecologist starting at either 16 or 18. The difference is based on if you're having any symptoms. Once you start your period, it can take a little while for your periods to normalize. And some things that we look at is if you're having pain that is not well controlled, because there could be something else going on that is causing you to have painful periods, and also want to make sure your periods aren't heavy.
Well, I'm the mom of 2 teenage daughters. Being a mom of girls is an absolute joy. There is fun, there is drama, there is crying, but it's all good times. When I'm talking to my daughters, I also let them know that I have doctor's appointments. I have a doctor, I have my primary care physician, I have my dentist, I have my OB-GYN. And so that they've known from very small children that you go to different doctors for different things. I've also maintained the fact that all of my physicians are females, be it my dentist all the way to my eye doctor. It's also important that they see someone that looks like them. So seeing women of color is very important when they go to their providers. And I think that makes them feel more comfortable in their skin, and then how they can then feel free to open up about what issue they may be having or what's bothering them, or, how to get the best treatment for whatever's going on.
Ready?
Come in.
Hi, Nella, how are you?
I'm good. How are
you? How's the family doing?
The girls are good. Everybody's good. My oldest is going to be a senior next year. We're looking at colleges, doing college visits and hormones and friendships and relationships. And so I want to establish her with a GYN before she leaves our house and moves on in her next phase of life.
Okay, this is perfect.
How do you determine at what point tampons are appropriate, and if it is, which tampon?
If they're held back by pads, like if they don't like the way that it feels, or they're changing it a lot, or you're going to the beach and you're going to be in a bathing suit, that's a reasonable time to talk about tampons. Selecting size kind of based on flow, but also selecting size based on comfort.
Of course, usually we start them off with a pad or the period panties. We talk about the size, applicator, okay? Gone are the days, they still probably have them out there, where it's cardboard. It's all about comfort, different activities, and then just kind of introducing it and see how they feel with it.
Even though I have my own OB-GYN, I didn't think that was the best fit for my daughter. And so as we are making that transition into her senior year, it was really important that I found someone that I think that she would feel comfortable with. I was able to call the TriHealth nurse navigator, and she was really helpful to listen to me to say, this is what I'm looking for my daughter.
We're gonna go over lots of information, see if they have any concerns. We can start educating them about breast health. What is normal discharge? What's not, what's a normal odor, what's not. Taking care of yourself, making sure that you're eating healthy, that you're exercising, that you're taking a multivitamin.
Do I need to be present for her in that visit, or would you prefer me there or not to be in the room?
A lot of parents will come, okay? And then when I ask them some sensitive questions, I will ask you to step out the room,
Okay.
okay?
Okay.
And then I'll have you come back in, and then we'll have a full conversation.
Okay.
Come back with your mom, or I had someone come in with her sister because that was how she felt most comfortable doing an exam. And our goal is to make sure that our patients are healthy and comfortable, and never to traumatize or scare them or in any way.
And a lot of times patients will come in and they're so afraid of what they've read on social media. And afterwards, they're like, oh, social media was wrong. I'm like, exactly, it wasn't so bad. I'm like, don't believe everything on social media.
The gynecologist or the OB that delivered my daughters is not necessarily who I have now, because I'm in a different phase of life. And so now I'm seeing someone that specializes in menopause and perimenopause.
What is the most common myth that you hear in women when it comes to menopause or perimenopause? Because we hear so much.
I think a lot of people come with the expectation that if I go to my doctor and I get prescribed hormones, that they're going to fix all of the things that are happening, as opposed to hormones are for hot flashes, night sweats, dryness, but not necessarily for everything. Like, we can work on everything for sure. I like to fix everything. That's one of the reasons why we're doctors, but sometimes it's not like a one thing fits all.
So you may need to supplement with other medications or doing other natural things. I talk to people about yoga, acupuncture. It's so much out there that can be done naturally to help with your symptoms.
It's so important that women value their own body and see this as critical, not only for caring for themselves, but being in a position to care for those they love.
Once I turned 45, it was like a switch that came on and everything just started changing all of a sudden. The specialist, she's absolutely wonderful, and she's only about 4 years older than me. So then it was also me feeling comfortable to say, hey, are you taking any of these, and what are you taking, and how does this help you? She said, take me through your symptoms. We sat and had a conversation. I take an estrogen patch. Just that little boost of extra estrogen lifted my mood. It made me feel just a little bit more of myself that I had not felt probably in the last couple years, but really just didn't know. I really feel like a whole person that is alive, is healthy, and thriving, and really able to be there for my family as well as my friends. I want to journey into my later life not feeling as though, oh, I wish I had taken better care of my health.
For women who don't know any of their family medical history, what screening tests or preventive steps should we do to prioritize and to stay on top of our health?
Coming in so that we could catch anything, do an exam, ask any questions, or like, hey doc, I have this lump. Being able to catch things earlier and take care of them because you were on top of your annual stuff, even if you don't know your family history, really changes that outcome.
I can't emphasize that enough to make sure that you're following up with your primary and OBGYN just to make sure that you're keeping up with your care and nothing gets missed. I feel like I have pressure or heaviness in my vagina area. Is that normal? That isn't normal. One thing that can happen, and usually is as we get older, okay, is we can develop something called prolapse.
We call it pelvic organ prolapse. So it can either refer to the cervix, uterus, or just the walls of the vagina. The tissue just loses elasticity. It's a normal part of aging. We're living a lot longer than we used to. We just don't have the same support, that lasts through our entire lives. So a lot of women describe the sensation of like sitting on a ball, or it's as if they have a tampon in place. Over 50% of women will have prolapse at any point in their life, but only 3% will ever seek treatment for it. When you need to see a gynecologist or a urogynecologist is when you start to become bothered by your symptoms. Either you're not able to empty your bladder all the way, you have UTIs, or it's just bothersome. There's non-surgical options, there's surgical options, so we have a whole wide array of treatment options we can discuss. Come in and see us.
Incontinence would be another issue that is not talked about.
Are bladder leaks just a normal part of aging, or is it something that can be treated? It happens to older women in my office, it happens to younger women in my office, and I think it's good that we're finally realizing that that's not like a secret and it's not something that we just have to live with as women.
Running, walking, laugh, cough, sneeze, jumping on a trampoline, that's another thing we hear quite often. So leakage in any of those situations where you're straining your abdomen, that's something that we can definitely work on. We have treatment options that range from pelvic floor therapy, medication, surgery. A lot of women have never discussed these issues before, so they come here and just seeing reactions of patients, learning they're normal. This is not something that's uncommon. It affects many women besides just them. And then just to know that there are a lot of treatment options.
How much discomfort or pain down there is considered normal, and when is it not?
I felt worthless because I just wanted to sit around all day and not do anything except go to the bathroom. That was all I did. I just had a mild UTI. I hadn't had one in, God, I don't know, years. Even though I started feeling better from the medication I got, I still wasn't 100%. I felt like something was wrong. I got to the point where the only places I went was to the grocery store and I joined a gym. Those are the only two places I went because as soon as I would get there, I'd have to go to the bathroom 3 or 4 times. My great-grandkids live in Florida, so we took a flight down. I had to go to the bathroom, and one of the ladies there said, "No, you can't. He hasn't turned off the seatbelt sign." I said, "I have to go now." And she's arguing with me, and all these people are sitting around while we're in air. It kind of made me not even want to go there anymore because I didn't want to be embarrassed or humiliated. I felt worthless because I just wanted to sit around all day and not do anything except go to the bathroom. That was all I did. I can't go to the store. I can't go visit my family. I can't do anything. I was depressed. I mean, I could start crying right now because it was that bad. There were days I just wanted to give up.
A lot of these issues that women deal with, sometimes it's not very apparent what the source of the problem is. Oftentimes, bladder pain syndrome is masked or confused with recurrent UTIs. So patients that have bladder pain but negative urine cultures, it often takes them quite a while to get in to see us and get treatment for bladder pain. By the time they get to urogynecology, they've already been through the ringer.
I thought, let me look in TriHealth, because that's who I always go to, and see if they have something. And I saw this urogynecology, and I thought, I never heard of it, but I'm going to sign up for it. I almost canceled. And my husband goes, I don't think you should cancel. You're still not 100%. I said, I think you're right.
Hey, Gail.
Hi, how are
Hi.
you?
Good. How are you?
Good.
All right.
Feeling great.
All right.
Yep.
Oh, okay.
Dr. Lewis specifically, I mean, she came in, shook my hand. I told her, I said, I don't even know if you can help me. I don't even know what's wrong with me. I thought I just had a UTI. She said, what's it feel like? I said, it feels like glass. That's exactly what it feels like, if you can imagine that.
We went through a couple different stages of treatment with her.
She started doing some tests. I probably came back in a few days later. She did some more tests. I had to fill out this form every day, how many times I went to the bathroom. And it would be like 20 times a day. I had crystals in my bladder, so they would put a catheter in and they would flush everything out.
Bladder pain syndrome, it's a diagnosis of exclusion, meaning we've ruled out infection, it's not your GI system, it's not contributed to anything else going on in the GYN department. Usually a pain associated with having a full bladder and feeling the need to empty that bladder to get pain relief.
I would learn something every time I came in here. Anything I would ask her, she would have an answer for. Or she would explain it, or she'd get a paper out.
Option 1, we can do nothing. Depending on how bothered by it you are, we don't have to do anything.
Okay.
Option 2 would be pelvic floor PT. It's a non-surgical option. Okay. I know, yeah.
I'd like to avoid surgery.
Avoid surgery? Okay. So we're back to option 2.
Okay.
Something you could manage yourself, or you can come back to clinic and I can manage it for you.
I'll go with you managing it for me.
Okay.
I'm like, whatever, just do whatever you think is best. She goes, no, I want you to know what we're doing, what's going on here. She talked so I could understand it. Here's your options. What do you think? We're going to try this. We're going to try this. I was like, oh my God. I was afraid she would give up. I think she knew how frustrated I was and that I felt like I was just fighting a losing battle. And she was out to prove me wrong. She said, we're not giving up.
She was a very diligent patient. It's a team effort.
And then I started having other problems. Well, they recommended that I have an ultrasound. And they found 20 stones in my bladder.
We finally got to the source of what was causing her issue.
He said, those need to come out right now. That helped me 110%.
We found a treatment option that was suitable for her, and she was happy.
It was the best thing that ever happened. I felt like a free person. I knew there was always hope once I met her, that she was going to find something to help me with. And she did. We had a long road together, and she never gave up on me. My husband, as soon as I told him, he's like, we're going to see the kids. Finally, I'm on a plane and we're headed to Florida.
We want to make women feel comfortable. We want them to share their stories and their symptoms with us. Our entire division is women, nurses, physicians, providers. We know that these issues can be sensitive. A lot of women are embarrassed to talk about them. They haven't discussed these with friends or family. This is my job. It's what I do all day long.
People continue to have those parts after menopause, right? So you have to continue to keep them safe, making sure that you're up to date with your age-based recommended screening so that you're staying healthy, you're taking care of your own body. And that happens not just when you have babies and not just when you hit menopause, but like every year in between. If you're having questions or you're having symptoms or you just want to know more about it, then that's like a conversation that you can have, and that's what a lot of people do come to us for now. Sometimes you might not have any concerns, but we might see something on exam that's like, oh yeah, that's kind of funky, we should check that out. Or have you had a mammogram? I felt something a little bumpy here. Doing that is a way to stay safe and stay healthy and improve your lifestyle. Most of us would never let their car go 50,000 miles between oil changes. So think of it as that. Like think of it as like healthcare maintenance, not just when you're starting birth control, not just when you're having babies, not just when you're having hot flashes.
Our job is to listen. We just want to improve your quality of life however we can. It's never too late.
It's not just birth control, babies, menopause, it's forever. And I think that that's like a whole new world of opportunity for women.
Women, we spend our lives taking care of other people, taking care of our children, taking care of our husbands, taking care of our parents as they're aging. And you have to know that it is important to take care of yourself. If you are not here and you're not taking care of yourself, who's going to help take care of all the people that you take care of? Take time for yourself. Go get a foot massage and take time for yourself. Doctor's orders.
There's a legacy. It's a legacy of love. It's a legacy of justice, a legacy of compassion and care that has gone on now for over 170 years. Women recognizing the needs and hearing the needs and seeing the needs of other women and creating that continuum of care that creates both health and healing. We're really continuing the healing ministry of Jesus. It's a calling, it's sacred, it's a vocation. It's where our passion meets the world's greatest need.